So recently, I was having a discussion with someone regarding hip shift in the squat, and so I wasn't planning to train today, given my current attire, but I want to make this video as we were having a pretty good discussion about it. And in this case, it wasn't actually within the squat pattern itself, with a barbell or with a dumbbell or anything like that, but it was just a what appeared to be a hip shift when someone was standing. So if you watch people when you're walking around, or if you're at an event such as a baseball game and people are standing for a while, what you're going to find is that a lot of people will shift into a hip. And so basically what this does is it rotates the pelvis on one side versus the other, and you're essentially just trying to bias yourself out of an extension pattern, tuck your hips underneath you a little bit more. This is kind of what bars did. If you look at most bars, they have a railing set up on the floor, or not on the floor, but just above the floor. And they found that when people stand for a long time, they begin to exhibit this more extension-based posture. And so if you can put a leg up onto a rail, that will actually posterior tilt the pelvis and thus take some load off of the lumbar spine. So if you watch people characteristically, what they're going to find, what you're going to find, is that a lot of people like to shift into this right hip. And you can do this just standing up. If you shift into both hips, one's going to feel a little bit more awkward. That's just the only way to describe it, but you're going to be like, that just doesn't feel normal, it doesn't feel right. And it's probably because you have just a habit of biasing this right hip. Now that's a whole other can of worms in terms of why you tend to shift into your right hip more. But essentially we have to look at it from a biomechanical standpoint. What's actually happening? Well, this side of our pelvis is getting tilted up, and this leg is getting internally rotated, while this one is getting externally rotated. So if we tilt this side of the pelvis up, what we're doing here is we're lengthening glute med. Because if we remember glute med here, it's responsible for tilting the pelvis the opposite way. So as soon as we shift into that hip and we've pushed the femur back into the hip socket or the hip capsule, now we've essentially stretched glute med, and we've taken this glute max out of position. So what is going to accompany that is, now that we've seen that the hips are offset, we're probably going to see a change in the position of the rib cage as well. We think kinetic chain here, we got to think up and down, above and below the joint. So we think knees, shoulders, and then above and below those joints, neck, ankles. So now we're going to see a change in the position of the rib cage. So if we shift back into this hip, what we've essentially done is we've posteriorly tilted this pelvis downward, and we've tilted this pelvis forward. So now what's going to happen is this pelvis is going to tilt forward, and typically if you see a bilateral extension pattern on both sides, you'll see the rib cage tilts up and out, and the pelvis tilts down and forward. So if we just have a rotation forward on one leg, what we're going to find is more rib flare on that side. So essentially we flip the ribs up on this side, but not on this side because we're still posteriorly tilted. And accompanying that, we're typically going to let that right shoulder slope and drop down a little bit lower. So a little bit tighter on the right side, spinal erectors as well as the lats. When we're trying to go into a overhead flexion pattern, we're going to find that this side is tougher to get this arm fully overhead and fully extended without compensating at the rib cage. So you'll find that in other things such as barbell rollouts or abdo rollouts, whatever you want to call them, as you're going overhead, this shoulder typically feels more restricted and a little bit tighter in the people that present with this common pattern. So if you're looking for a little bit more of the understanding of this methodology, you can look at Postural Restoration or PRI's website. They're kind of the hot buzzword now in strength and conditioning, but essentially it just revolves around these patterns and why we shift into those patterns and then getting folks out of those patterns and back to more of a more neutral state. So it's very interesting. You can watch people as they stand around. You yourself can try to be more cognizant of it. Try not to shift into that right hip as much. Try to get into your left hip a little bit more. And so there's a variety of drills you can use to do that. But just being more cognizant of what side am I shifting into, what shoulder is lower. If I'm stretching one day and I get out of bed, does this side feel tighter when I side bend to this side? Typically when I do that, I get a couple cracks and pops, just kind of opening up this side of my rib cage. Other side, not so much. So for me, I typically fall into that right stance pattern. So if you're watching a lot of my other YouTube videos, I'm typically shifting into this hip because I'm trying to think about getting out of that right side and more into that left side. So it's just something to keep in mind, and also something that if you're looking at progress pictures of yourself or someone else, considering where's the pattern starting. So if I'm seeing a low right shoulder, is that just because of a muscular issue, muscular weakness, or inhibition at the shoulder, or is it more related to something that's going on at the core and at the hips, and thus because of the kinetic chain we're seeing feedback into the shoulder? Or, for example, in the ankles, if we have an extension pattern where someone's globally extended and their weight shifted forward, all of this posterior musculature from the hamstrings all the way down to the calves is going to be firing to keep that person from falling forward. So for example, if you think about people that wear high heels or even dress shoes with a small heel lift, that's going to shift your center of gravity forward, and thus a lot of that posterior musculature is going to have to turn on to try and pull your center of gravity back. So it's not necessarily an ankle mobility issue, it's more of a core stability and pelvic positioning issue. You correct those two, all of a sudden the ankle shut off, and wow, we got all this ankle mobility that was already there, but we were just fighting the influence of gravity and our poor biomechanical positioning. So just something to keep in mind, something to think about, look at on your progress pictures and other people's.